There we go. Okay.
Yes.
All right.
Thank you.
Absolutely.
That was amazing. Oh my God.
Good.
Oh,
Good.
So good. That's what I mean in the foot. You got it.
Yeah. Okay.
That's what I can't get on. Whatever you just did.
In the feet,
in that
yeah.
foot, yes.
Feels better?
Oh my God, yes.
Good. Good.
The lights popped. It felt so good. Oh. Much better.
Good.
I don't have that pinch.
Good.
Yeah.
Okay, so I was looking at your chart. So you're having some little pain with your right hip when you're going into internal rotation, a little bit of stuff going on with the ankles, and you're having some left hip and knee and everything as well?
Yeah, I mean, ever since, honestly, since my surgery, like, it just depends, but, like, I just always kind of have a lot of lateral hip pain. But, like, the last...
That was the ACL surgery, or did you have a hip surgery
ACL.
as well? Okay.
Yeah. I would say in the last, like, 2 weeks or so, it's been a little bit more elevated. I've done some jogging on it. I don't sprint much anymore.
Yeah.
I like to be able to.
Mm-hmm.
But, like, I just... like, what was I don't know. Like, I was just sitting, doing, like, a deep squat the other day, and it's like everything wants to shift.
Yeah,
like,
away from the right hip.
It's just really jammed up in there. And I was like, dang, man, I gotta do this. And I was like, Yumi, like, just go see Stratton.
Yeah.
Like, it's not like your back is connected to everything. So in my mind, I was like, maybe an alignment would actually really help me.
Yeah. Yeah,
So,
and we can adjust your spine. We'll see everything there.
yeah.
We can also adjust the hip and the knees and the ankles and everything if you need it.
That's what I was thinking. So.
The hip pain, is it more like kind of sharp, like pinching, or is it more dull, achy?
It's a little bit pinchy.
Sharp pinching?
Right here.
Yeah, okay. And then is it the same on the other hip? Is it the same on the knees? Or?
No pain on the left side.
Okay. And then the right knee also sharp or more dull?
It's more of a dull
okay.
lateral. My meniscus tear was medial, but it's more of a low lateral. And also, like, my foot, I always feel like my foot needs, like, to get, like, okay, so
pulled.
Before I work out, sometimes I do this. I'll step on it.
Yeah.
And it'll pop sometimes, but just that feeling of, like, creating some space feels so good.
Gotcha. Okay.
Yeah.
So we can definitely take a look at that.
Here feels like it just kind of goes. Like,
yeah.
tight.
And then you feel like you can move a little bit better. And okay.
Yeah.
Gotcha. Okay. And then anything I need to know about with your spine, like any like major injuries or anything like that?
Nope.
Okay, cool.
No.
And no surgeries in the spine?
No surgeries,
okay.
No injuries.
And how long ago was the ACL? I mean, that was...
a long time. So the first one was in 2008. The second one was in 2011.
Okay. And you just had a repair, not a graft? Or was there a graft in the repair? Okay.
First one was hamstring. Second one was, cadaver.
Okay. Yeah.
Yeah.
And then not like a total knee though. It was just the... Okay.
Yeah, just ACL. And I had barely split a meniscus, and they just like
trimmed off some of
that
the...
yeah. So it was off because it gets locked and
gotcha.
it's horrible.
Okay. Well, let's see what's going on here. Let's start by taking a look at how well you're moving, and then we'll get you on the table and we'll see how everything feels. So just sit up tall for me, and then bring your chin down to your chest. Touch it if you can. Okay. And then look up to the ceiling back. Okay. Back to the center. Look over your right shoulder as far as you can. And then your left. Okay, we're definitely a little stiff there. Yeah. I hear you making some noise. Is that uncomfortable?
Yeah.
Okay.
My neck, it just depends on how I sleep.
Yeah.
I wake up in the morning and it's
feeling stiff.
Yeah.
And let's have you stand right here for me. You're going to face towards the door.
Okay.
You'll reach down, touch your toes as far as you can. Okay, good there. And then come on up, bend back. So you kind of put your hands in your low back and then extend through the lumbar spine as far as you can.
My hips always do that, by the way.
Okay.
So if I squeeze my butt,
yeah.
and I push my hip forward, I get like a pop.
Yeah, in your pelvis. Here. I can do the same thing sometimes with my sacrum.
That happens, yeah. So just...
yeah, sometimes if those SI joints are fairly mobile, you can get that self-pop.
Okay.
Yeah.
It scares people. I'm like,
nah.
It feels good.
You ain't gonna fall apart.
Yeah.
Okay, let's see how everything feels once you're on the table. So let's go face down to start. Your face will go right here where the paper is.
I just put like my oils on and stuff.
Oh, you'll be all right.
Okay, sorry.
Yeah. No, you're good. I wiped the table down between everybody. And there's a little handle right there for you.
Hold the handles?
Yeah. You don't have to like death grip it, but just kind of rest your arms on it. Definitely tight through here. So you've been adjusted before, right?
Mm-hmm.
How long ago was that?
Oh, quite a while.
Okay. Years or months?
Years.
Okay. Yeah, your hips feel pretty good. Maybe a little bit right there, but not much.
Okay.
For you, it's more going to be this low back and lower part of your thoracic spine, like these ribs in here.
Those are tight, yeah.
Yeah.
And sometimes I feel like on my left side, like almost like a little tight when I'm breathing sometimes.
Yeah, I can feel this all through here. Okay, let's start up here, and then we'll work our way around. So I'm going to put my hand here. I'm going to give your head a little turn. Just keep your neck nice and loose for me, okay? I'll do all the work. Good. Breathe in. Out. Good. Okay, let's see now. I'm gonna put my hand under your hip here, okay? I'm gonna use this kind of like a handle. So just let your belly be nice and relaxed. We're gonna give you a little push. Okay, one more. Okay, a little tough in those ribs. Deep breath in, out. Okay. We may try some of that from face up because this feels like it needs to go. Okay, let's have you lay on your back for me.
It feels great. It's like, ooh. Especially that hip thing you just did.
Let's get down just a little bit.
Down.
Yeah, perfect. Okay, let's try that one more. All right, we're gonna go here.
Cross. Okay.
Yeah. Okay. Breathe in, out. Blow all your air out. Okay.
Oh, feels good.
Tough through there.
Oh. I was like right in the middle. It was like the lightest pop. It felt so good. Oh.
Okay, let's take a look at everything else now. So, scoot up towards me a little bit.
Scoot up.
Yeah.
Should I just let my hands relax?
You can just kind of fold them on your belly or whatever you want to do. Okay, right there. Good. Good. Okay. Awesome there. And let's start taking a look at this. So the hip here, if we go into internal, pinching sensation.
Yeah, I feel it. It's,
Okay.
Well, not the pinch, but like it's like my hip flexor, I guess, but it's right here.
Yeah.
That side, nothing there.
If I go here and I push down, any pain?
No, it actually is a little relieving.
Okay.
Yeah.
And then what about if we come out like this?
No, not pain, just like tight.
Just some tightness.
Yeah.
Okay.
But like not like pain tight.
Nothing
You know what I mean?
crazy. Yeah. Let's take a look at the other side.
Okay.
Yeah, this one goes into internal rotation more easily.
Yeah.
A little bit hung up on external here.
Makes sense, right?
Yeah.
Yeah.
To kind of be
So it's
opposite
kinda
like that.
Yeah, like that. Okay. Is that the way?
Yeah, you're kind of restricted on internal. It's almost like your body's leaning this way because both sides don't want to go to the other way. Okay, we're gonna give you a little pull on this one real quick though, because this ACL, no pain or anything. If I give you a pull there, knee feels fine.
Knee's good.
Okay.
Oh, that's so good.
Good.
That's what I mean in the foot. You got it.
Yeah.
That's what I mean.
There's one more in the foot here.
Yeah.
Let's see. I'll do one more. There we go. A little bit. Good. Okay.
That's what I can't get on my hand. Whatever you just did.
In the feet,
in that
yeah.
foot, yes.
Good. Good. Okay. And let's scoot you up.
Okay.
And we'll have you roll on your side. You're gonna face me over here.
This way?
Yeah. Cool.
Oh,
Feels better?
oh my God, yes. Like that foot just feels like it's jammed. I don't understand it.
Okay, this is for the low back.
Okay.
Breathe in. Out. Good. And then other side. Yeah. And this is gonna be for that right SI joint here. I'm gonna pull you off this arm a little bit. And actually, I lied. We're gonna do something like this.
Oh, okay.
That okay for you?
Mm-hmm.
Okay. Breathe in. Out. Loose belly. Good. There we go. Okay.
Yeah.
All right.
Thank you.
Absolutely.
That was amazing. Oh my God.
So let's take a look at a few of those ranges of motion again, and we'll have you drop down into like a little squat and see how everything feels. So let's do your toe touch. So go ahead, stand right here and face towards the door. Yeah. Mm-hmm. Good. And that was looking great before. Yeah. And then let's have you go.
I gained like another.
You put the palms flat on the ground.
Great.
We'll have you extend through the lumbar spine. Good. A little better.
Yeah.
And then let's have you do like a little deep squat like you did before, kind of face towards me. Yeah, and see how that, yeah. And see if that feels the same or if it feels better than it did.
Much better.
Good.
I feel a little bit of like tightness.
In the low back?
Right in there. And that just might, I need to do some trigger point, but
yeah.
I don't have that pinch.
Good.
Yeah.
And then let's have you sit right here for me. And we'll do our chin down to the chest. Good. And then look up to the ceiling. Over your right shoulder and over your left. Looks like you're going further. Does it feel as strained as it did before?
Not close. Like this almost hurt the first time.
Yeah.
Just feels nothing.
It feels more free now. Yeah. Well, you moved really well. So I can tell that your spine is healthy. I can tell that your joints are healthy.
Okay.
We just had a little bit of like an asymmetrical hang up to where, you weren't wanting to, on your right hip, you're not wanting to internally rotate and your left hip's not wanting to external. So it's almost like your whole body is just like pivoted this way and doesn't want to come back to the other side. So maybe that's something that you can kind of pay attention to. I don't know, like things like shin boxes and stuff like that, different mobility work that you can work on for your hips.
Okay.
You know, those ones where you're sitting down and you bring the knees in. Yeah. And just kind of try to bias it towards the sides that you have the limitation on and see if you can work into that on your own.
Okay.
And then I'm always here for you. With your spine feeling the way that it does, I don't think you need a ton of care. Okay. For somebody like you, I'd say anything like once a month, maybe twice a month if you're feeling like stressed, you had a hard month or things feel gunked up. Okay. But for somebody like you with how well everything's moving, once a month is probably fine.
And what about that foot? This feels so much better. It's so hard to explain to people when I'm like, you don't understand, my foot just feels
jacked. Yeah.
I mean, like, so much better.
It's hard to get that decompression, to get those small bones in the foot to open up, like those tarsals and metatarsals, all those tiny little bones in there. So, I mean, that's definitely something when that starts to come back on you and it's getting to the point where you're like, God, I just can't deal with this, then come on in, we'll get you hooked up.
Do you recommend, so I have a massage scheduled for later on today. Is that I thought I should do chiropractic then?
Yeah, that's generally what I recommend.
Okay.
And the reason for that is that some of the muscle spasm and stuff that you're dealing with is reflexive and it's mediated by the joint restriction. So like that joint is stuck and that's causing the muscles to spasm to try and either relieve the stiffness or to brace the area because your body thinks it's injured. Okay. And so what ends up happening is, you go get a massage before chiropractic, they might spend 30, 45 minutes just hammering on something that is just going to stay stuck in spasm until that joint gets adjusted. Okay. Whereas if I come in and I adjust you, it gets rid of all the reflexive muscle spasm. So when you go to your massage therapist, they can feel all the things that are still left over that are really muscle problems. So like you're feeling in your back there, right? You're like, maybe I just need to get some work done. Yeah, after we got those joints to open up, now that little bit that's left, we know that's actually the muscle. So they can go in and target that and use their therapy time like more efficiently. So. Well, cool.
Thank you.
Yeah, you're so welcome.
You just charge the card?
Okay, perfect. Yeah.